Hello everyone, I'm Dr. Rohan Khandelwal, your Marrow SS General Surgery faculty, and it's an absolute honor to be introducing Dr. Swapnil to all of you. He secured rank 1 in surgical gastroenterology in the recently conducted INA SS exam. And I'm also joined by Dr. Venkatesh today, who's the surgical gastro faculty in Marrow SS. Welcome both of you. Heartiest congratulations, Dr. Swapnil.
Thank you so much, sir.
Hi everyone, congratulations Dr. Sapna.
Thank you.
So, Swapnil, you're an undergraduate and postgraduate of MAMC. Why don't you tell us about your journey for SS preparation and tell us when did you start using the Marrow SS app and how did the journey begin? Which year did you start preparing?
So I've had a long relationship with Marrow. I've used Marrow from my undergraduation for my post-graduation entrance as well. I have attended your classes, sir, specifically all the general surgery classes that you have conducted, and then all your videos on the Marrow app, and all the MCQs on Marrow for my postgraduate entrance. Then when I wanted to prepare for my SS exams, I again consulted Marrow. I again started watching those videos by the end of my second year, along with reading of my textbooks and solving some MCQs here and there. Specifically, seeing first the previous year questions, whatever they were, and then reading. So I've seen all the surgical gastroenterology videos by the faculty on the Marrow, probably one or two left. Otherwise, I've seen all of them. And I've read all the important topics from general surgery, thyroid, breast, endocrine, trauma that you had put up on the Marrow app. And so I've given, I think, all the gastroenterology tests since 2023 that were there in the Marrow app, and I've secured a rank of 1 in most of them. And that's about it. Even until 4 days before the exam, I had given a test and secured a rank 1.
Great. Now I see a great diagram over your left shoulder of the liver and other things. So, how did the interest in surgical gastroenterology start? And you said you started in second year post graduation. So, was it just a natural inclination because you're more exposed to gastroenterology during post graduation, or was it any other reason?
So, sir, I wanted to be a surgeon since the second year of my MBBS and a surgical gastroenterologist since the final year of my MBBS. That much was clear. I did not know
Any
how I
particular
would do it.
reason?
No specific reasons. I loved the subject. I loved attending OTs. I attended all the emergency OTs as an intern. I used to love standing there for hours, seeing bowel getting resected, anastomos, liver injuries getting treated, gallbladder cancers getting operated. So when I took up general surgery at MAMC, fortunately, I was allotted a unit in which the consultants were doing a lot of surgical gastroenterology procedures, some radical cholecystectomies, colectomies, and some esophagus surgeries as well, and a few Whipples here and there. So I had a lot of exposure to surgical gastroenterology. And then in my second year, I thought I'd start because it takes time for you to prepare. Then I consulted the Marrow app, did all my preparation. I started reading Sabiston from the second year along with Bloomgard and Shackelford. So one thing I have seen other toppers videos, and people have only read Sabiston and seen app videos and done MCQs, but I somehow could not do that. I have read all the books completely and multiple times. I could not get a grasp of the subject without reading it. So Bailey, Saviston, Shackelford, Bloomgard. I have read all of them.
Fair enough. So I handed over to Dr. Venkatesh now to deep dive into the surgical gastroenterology preparation because this is one of the most competitive branches and the maximum number of students appear for this branch. So I'm sure they would love to listen from your experience and they would gain great insights regarding preparation as well. Over to you, Dr. Venkatesh.
Yeah, hi. Congratulations again, Dr. Swapnil.
Thanks.
It's a phenomenal feat. Is it like still sinking in, right? Like you would say it's still unbelievable. Yeah.
It's been 3 days and I still don't believe it.
Phenomenal, man.
I think so the
Congratulations.
amount of focus which you had right from final year of undergraduation, I think so that is the main driving force. But of course, the hard work which you put in, but to dream is very important first, and then to execute that dream is, you know, I feel that becomes a bit easier once your focus is very clear. So that's what you've shown.
Yes. Thank you.
So, like among the resources, how is your weightage? Like videos were primary. I'm sure like that it's really good that you have actually read all the books. But
Yes.
how would you rank among the resources? Like, how would you share, give a weightage, if at all? What has helped you most?
So, sir, we surgical gastroenterology is a very deep subject and a lot of information. So, simply by reading the textbook, I could only grab around 20-30%. So, for example, esophageal manometry and those motility disorders, just giving an example, I did not understand anything
Happy
after
that
reading the
you're
textbook.
telling examples from my topic.
Yes, sir. So, I could not understand anything. Then I sat down, watched your videos, made my own notes, tried to understand the subject repeatedly, and I watched the videos around 5-6 times, specifically esophageal motility disorders because they were very tough. Then I reread them from the textbook, and I focused on the previous year questions whichever were asked, the Chicago classification, everything. It's not possible to simply rote learn all this and then vomit it out in the exam. You
Correct.
need somebody who will teach you all this and make you understand. So your style of teaching was very simplified. It made it very easy for me to. So I made notes of all the videos in the surgical gastroenterology section, and some of them I read from the oncology topics as well. Uh,
Fantastic.
but I did most of it from surgical gastroenterology videos, and then if I needed more clarity or more information, then I read it from the textbook.
Great. Awesome. And so, like, when did you actually start for surgical gastro preparation? Like, how long did it actually take?
So I would say I started reading bit by bit in my second year of MS. So,
Hmm. That was
and
when?
I passed out last year, so maybe 20, last year was 23, then 22. 22 I started seriously
Got it.
studying for late in my second year. Then I cleared my MS in 2023. I've given the INSS exam 4 times,
Great.
and in the
These
first
are
time
looking for, yeah. Hmm.
I did not clear the theory part. I did not even clear the theory. Second and third times I cleared the theory part. I got more than 50%, but I did not get selected for interview. And this time I got selected for the interview, and this was my first interview. I've never given interviews before.
Great.
So the first 3 exams I could not really decipher what was going wrong because I was reading, I was doing MCQs, and I was getting good ranks in all the grand tests. But this time I think that I left the SR ship wherever I was doing, and I sat down and I thought I'll just give it one more try, one final try before this dream extinguishes. That is what I
Fantastic.
thought, and then I
The idea was like, if someone starts today, right?
yes,
The
sir.
idea is like how long it's going to take for them to actually, crack. That was the idea behind that, asking you that. So, and so how, like, post quitting your SR ship, how long was the duration?
So, sir, as for the first part of your question, I don't think there's a fixed time for anybody, but I think a good 1 year is required for the INSS exam. It's a highly competitive exam, and by a mere zero point 0.3 or 0.6% of marks, you will get out of the race. So that is one thing, and second thing, I was working intermittently. I was not doing an academic SRship or SRship in a medical college. I was working intermittently in a private setup, but I was mostly focused on the SS preparation. So not really working like those SRs in government medical college general surgery work. Because I was very clear, I cannot do it. I cannot operate for 2 days straight and then go read my books. I could not do it.
Correct. That makes sense. Because again, this is going to help someone else who's preparing, right? Because one thing, physical stamina, and then it's all about mental stamina also. Like, you'll have to push through, and that's great. So, can you describe how the last few weeks, like, how did you actually revise? Because it's such a vast topic, right? I'm sure you would have made your own notes, but then is there is always a feeling that have you made the notes complete? Like, what if you had left out something, right? Yeah. So, how did you balance that?
So I had started making notes from the Marrow videos by the end of my second year, and within the third year, I'd made. By the end of third year, it took me a long time to make those notes. But by the end of third year, I'd made my notes. I used them for my MS exams as well, and then I kept on repeatedly. Once I was done with the topic, for example, if I'm done with benign esophageal disorders, I used to do all the MCQs which are available anywhere and everywhere, and I used to do the previous year questions, focusing on what was asked. Then, if there was any discrepancy between my marks or I felt that I did not understand this topic well enough, so I reread it as many times as it took me to perfect that topic. So for example, again, esophageal motility disorders, I must have read around 15-20 times to remember that Chicago classification. It took me a lot of time,
Yeah.
and I read it, and I used to focus on previous year questions because the INISS is definitely a lot of image-based questions, and those images are sometimes directly from Shackelford and Brookard. So you need to know what all will be asked, the important topics, and then you need to really focus on it. That's all.
So Swapnil, you said that you gave INISS 4 times. So
Yeah.
somebody who's preparing for surgical gastroenterology, should they, I mean, somebody as focused as you, somebody who's preparing, who'd read all the books. So will invariably, if you're going in for gastro, do you need to be prepared that there'll be a lag of at least 1 year before you make it to INISS?
Easily, sir. I think it is one of the most competitive branches to get, and I don't think anybody should be disheartened. People give, I have given 4 attempts, people have given many more, and I think it's nothing to be disheartened about.
So that's exactly what I want to know, sir. How do you keep yourself motivated once you've given an attempt, 1 attempt, 2 attempts? How do you get that motivation again to give a third attempt?
So,
What would be your tips regarding that?
so my motivation is right there in the background.
Yeah.
Last year, when I did not clear the INSS exam, I did not get selected for the interview. I had a difference of, I think, 0.5 marks from the one who got selected for the interview, or something like that, 0.5 marks or 1 mark. So I was quite sad. So I went to the market, brought a chart, and drew this diagram. And every day that I get up, I see it, and I say to myself, "This is the Whipples. This is the hepatectomy that I'm going to be doing throughout the rest of my life, and I cannot give up right now."
So focus, I think, so is very important. Look, I think so. Resources are there for everyone. Everyone is doing the resources, but to have that focus also is very important, which is a great takeaway from our short conversation. What I can gather. Coming to the questions part, so you said that you have been solving all the MCQs from the Marrow app, the surgical gastro, and the SS questions. So,
Yeah.
what difference did you notice? I mean, the reason why a lot of students choose it for undergraduation is the robust evidence and the references which it is bringing. So, did you feel that difference in the SS app as well for the questions here, that the references were authentic and it was easy for you to trust them?
So the references were fine, sir. They were all from standard textbooks, and I could easily verify them if I had any doubt. Also, I watched your general surgery recall videos on YouTube and sir's surgical gastro recall videos on YouTube of all the previous year questions, and I noted down all those topics, and those MCQs also I did, and on those on the app also I did. So I did both of them, all the recall
And
videos.
what percentage of repeat questions directly are asked in the surgical gastro and the general surgery part? Were there repeat questions or were there repeat topics?
So, sir, I feel that it is the topic that gets repeated, not the questions per se. Probably questions as well, but mostly the topic. So, if they've taken a question from one paragraph on one page, they'll take it from another paragraph on the same page. This is what I feel. For example, trauma. They've asked GCS in every each of the exams that I've given. All the 4 exams they've asked GCS. They've asked about CA esophagus in all the exams. There's very some specific EHPV and NCPF topics which are not really highlighted in any of the main general surgery or surgical gastroenterology textbooks that you need somebody to teach you. They were also highlighted by sir's videos, and they are repeated every year. So the
So
topics are
another
repeated.
question which I want to, and which I'm very keen on asking, ask all INSS rankers, is that because you people are so focused and you're looking only at surgical gastro, sometimes the general surgery part gets neglected. So uh, how much time before the exam do you decide, okay, now I need to focus some time on general surgery as well?
So, sir, one needs to know where he or she stands with respect to general surgery. My general surgery was strong. I never had a problem with general surgery. I've always wanted to be a surgeon. I've read Bailey lots of times, and the new Bailey is absolutely fantastic, especially the breast unit. So I had read it for my MS exams, and I did not actually give up on reading general surgery any time before the exam. I revised the breast unit one day before the exam. I revised all your trauma notes one day before the exam, and I revised because I knew I would get through from surgical gastroenterology side. Probably it would be general surgery that would be taking me down, because I think everybody who's doing INISS will already be reading surgical gastroenterology. It is thyroid and the stagings of breast cancer and everything that takes you down.
Yeah, so I mean that's a key takeaway. When you're so focused about a particular branch, you're giving 2 or 3 attempts. You, as Swapnil is saying, you will clear the surgical gastroenterology part, but the general surgery should not bring you down. So simultaneously, one should be revising that as well.
Definitely, sir.
Perfect. Over to Venkatesh sir. I think so. He would want to also ask you regarding the interview bit because a lot of students would be interested in knowing what exactly was asked in the interview. Over to you, sir.
Yeah, hi. So coming to the theory part, like how was the distribution? How would you distribute between hepatobiliary, upper GI, and colorectal?
I cannot give you an exact distribution, sir, but some important topics have been repeated all the times. Gallbladder carcinoma
Like hepatobiliary is primary, right? Because I
is a
think it
big,
is both the students as well as the examiners. Yeah,
definitely a big chunk, and definitely a big chunk. I wouldn't say it is a small, but it's a big chunk. I would say probably 60-40, 60% being the luminal part and 40% being the hepatobiliary part. Definitely a
great,
major.
got it. And yeah, coming to the interview process, like how was it? Like how does it happen actually?
So the interview happens in two parts. One of them is a two-course viva. So in one part of the interview, they'll two senior examiners would be sitting and they'll ask you one case each, and the second one would be a spotter. So the spotters, they had given you 2 minutes to see the spotter and answer the questions that were displayed on the screen, and they were not the you could not see the examiner's face. So you simply had to give an answer and move on. After 2 minutes, if you'd given an answer, they would move on, and after 2 minutes, if you did not give an answer, they would move on. So you did not know whether you were right or wrong. You just had to answer, and that was the end of it. The
And
it
what were some of the spotters?
One was a forest plot, sir. One was a CT abdomen of EHPVO patient in the portal venous phase, so you could see the collaterals. And one of them, I don't really remember the other spotters, but they were not very difficult. They were okay, but they were confusing. I am still not sure whether it was EHPV or not. I'm still not sure. It looked like EHPV, so I answered EHPV. And in the Viva, so there were two senior examiners. One of them asked me a case of a 55-year-old lady who had rectal bleed. So how would you approach the patient? What would you examine and everything? And second case was of dysphagia. So I think I did not do well in the dysphagia exam because sir did not look happy. Sir was quite disappointed with my answers. So I fretted a lot over that. But the other part was okay. I do not know whether what answers I gave for the spotters were right or wrong. I have no idea.
Great. No, but if so, it's basically they give you a scenario and then extrapolate on that, right?
Yeah.
So
So
how deeply do they go into the topic, like up till the management post-operative?
So my dysphagia patient, the question on it which it ended was that which chemotherapy is better for mid-esophageal adenocarcinomas, FLOT or MAGIC regimen, and I had no idea about it. I don't remember.
Yeah,
I must have been FLOT, but I did not want to do any guesswork. I simply told them, sir, I have no idea.
that's true. This worked in your favor. That's good.
Not, I did not guess anything which I did not know.
That's great. Good then. Uh, Anything else you would like to add, Dr. Rohan? Yeah.
Any other tips, Swapnil? So, I mean, somebody who's starting off this year, and this is another thing which I wanted to touch upon that there's so much of chatter going on social media that less students are taking up surgery. Surgery is going out of vogue. So, somebody who's getting into surgery, who's passionate about surgery, and they know that in today's world they would have to specialize, what would be your tips how to go about, when to start reading, how to start preparing for super specialty?
So I also feel that a lot of people do not want to take up surgery because it's hectic. It's a lifelong labor of love, and if going into surgery, you know that then it becomes easier. At MAMC, surgical residency is hectic. First year is quite terrible, honestly. But if you know what you're getting into, then it's okay. But you really need to have that passion to go in. If it's so, and I think it will work in our favor if toppers are not taking up surgery. I think it works in everybody's favor. It's not really a bad thing. If
I,
toppers taking up surgery, I don't think it's a bad thing.
I think so. Both me and Dr. Venkatesh would agree with the fact that, once you're coming into practice and once you're getting into residency, it's really not about toppers or not being a topper. Even somebody who's passionate about it can turn out to be an excellent surgeon. And you
Yeah,
really don't need to be a topper to enter into a branch and then do well in practice. They're actually two separate things.
definitely.
Practice and training and getting a rank, they are not, they don't, there's no
Commensurate.
correlation between them.
True.
Is not commensurate in the real world. Also, I think yes, everybody who's getting into general surgery at this moment of time should at least have an idea of what they would like to subspecialize in if they need to, because the market is getting highly competitive. Although I did it out of pure love, I did not want to do anything else. But if anybody is coming into general surgery at this moment of time, they should have a fair thought about it. I think. Do not get into this
What if
branch.
they don't have a fair thought? I mean, a lot of them probably will not. And I guess one of the reasons why people gravitate towards surgical gastro is because that's what they're exposed to most. Um,
That is
but
true.
very few would be focused like you that, they know that they want to do surgical gastro and that's why they're getting into general surgery.
So by the end of residency is also fine, sir. I think, matlab, if you are fine being a general surgeon, it's not by any means inferior. It's
True.
not by any means inferior. But yeah, if you have an idea, then I think it kickstarts your preparation. You can kickstart your preparation earlier if you have an idea.
Must do books which they should definitely be reading.
Bailey, Sabiston,
Hmm.
Bailey, I've read cover to cover, and all you, matlab, everybody knows thyroid, breast, endocrine, trauma is from Bailey, totally Bailey. Sebastian gastroenterology, very important. All the diagrams, all the tables, all the charts, everything. And even though I've read the whole of the thing, but AINS has always asked only specific questions. They do not go into other
Did
topics.
you appear for the NEET SS exam?
Yes, sir.
And what was your rank there?
104.
So how's the preparation different from NEET? And I'm assuming that this was the attempt right after your MS.
2 months after my MS. So I had actually gotten into SGPG at Lucknow. I had gotten a seat, but I did not want to go there for a number of reasons. So I wanted to give the exam again. I was dead set on getting either AIMS New Delhi or GB Band Hospital, where I'm currently working as a non-academic senior resident. So I gave the exams again. And the preparation is different in the sense that INISS is more repeated. They have some core concepts and core topics which they repeat, along with new questions sprinkled here and there. NEET SS is totally and completely general surgery exam. So I could not predict what questions they would ask and from where they would ask.
Fair enough.
And in addition to the books that I mentioned for INSS, people did read Schwartz for NEET SS. I did not. I did not have the time or the energy to read Schwartz.
Okay. So I think so we've gained great insights from your preparation, Swapnil, and heartiest congratulations once again. I guess for me, the diagram behind your left shoulder says it all. And I am sure you're going to do extremely well in the future as well. Heartiest congratulations.
Thank you so much, sir.
Congratulations, Swapning. We are now
Thank you,
fellow
sir.
guests. Just see you from conference or something. Yeah,
Definitely, sir. Definitely. Would be lucky to meet you.
definitely. All the very best.
Thank you.
Thank you. Thank you,
Bye.
everyone.